Good morning. The second half of your book talks about drug classifications, prefixes, suffixes, and kind of goes through each category of drug. We don't have enough time in a 5-week course to cover the entire book, but the second half of the book is very important, especially depending on what discipline you're going into. So I'd like to discuss some key drug classes, some memory tricks for helping you remember when it comes to pharmacology, and some clinical pearls or things that are most important to remember about those particular categories. So some study tips and memory tricks, how to maximize your memory retention. Chunk by drug class. So if you group your meds by category, learn their common suffixes, you will be able to better understand their mechanism of action, their side effects, their adverse effects based by class instead of memorizing 1,000 medications that go in that class. Use memory devices. Something that has been successful with students in learning pharmacology and trying to memorize is building a memory palace or creating a mind map using vivid associations to help with memory retention. And I'll talk about that a little bit later. Practice active recall. So quiz yourself often. Memorization is great, but if you can actively recall something that you've memorized, it'll help store it in your long-term memory. Cover and then recite the key points and using flashcards. Flashcards is actually very effective for pharmacology. Space out your reviews. Review these over several days. Revisit your weak areas and mix old and new material together. And then teach it back. Explain it out loud. Teach a classmate. Talk to your pet. Talk to your child. Saying things out loud and teaching to someone is a really great way to have memory retention. Connect a drug to patient care. So if you're already working in a patient care area, you may have seen some of these drugs being used and maybe even know what they're being used for. So the best retention comes from repetition, retrieval, and making meaningful connections. So the first group I want to talk about is cardiovascular and blood pressure medications. Okay, so we have a couple different categories here. ACE inhibitors tend to end in pril. So lisinopril and naproxen. So pril relaxes pressure, if you think of that as a memory trick, or come to think of some different ways. When I studied pharmacology a long time ago, I saw a mnemonic, which I wish I could find now. And it was a picture of an ace playing card wearing a pearl necklace. And anytime I try to remember what my ACE inhibitors are, I see that in my head, and then I know that they're prils, prill, pearl, close relation there in verbiage. So ACE inhibitors end in pril. ARBs, they end in sartan. So losartan, valsartan. Memory trick might be sartan stops angiotensin. Our key points here, it lowers BP, monitor kidney function. Now, with our cardiovascular medications, one of these in particular causes a cough, and that is the ACE inhibitors. Our third column here, beta blockers, end in OLOL, okay? Metoprolol, atenolol. Memory trick, OLOL shows it all. It slows heart rate and BP, and we have to watch for bradycardia. Diuretics, for example, furosemide or hydrochlorothiazide. Diuretics drain fluid, right? Reduces fluid volume, and we need to monitor electrolytes. Some respiratory and GI medications, bronchodilators. These open the airway, but they can cause tremors or tachycardia. Inhaled corticosteroids. Steroid spray reduces swelling, so knowing that this is for inflammation. Important to rinse the mouth after use. PPIs usually end in prazole, like omeprazole or pantoprazole. Memory trick. Prozole puts out the protein or proton acids. Okay, so this reduces acid in the stomach. It's used for GERD. It reduces how much acid your stomach produces. Antiemetics, like ondansetron. Ondansetron settles nausea, so that's Zofran. Key points: prevents nausea, vomiting, used with caution for QT prolongation. So prolonged QT syndrome is something we look for in antiemetics. Anti-infective medications. These are your antibiotics. So we have penicillins, like amoxicillin, penicillin. They end in -cillin. The psyllin family kills bacteria, right? Just remembering, treats infection, check for allergies. There's cephalosporins, like cepfloxacin or ceftriaxone. A memory trick might be ceph fights the infection. This is useful for many bacterial infections. Macrolides, an example is azithromycin, so mice. Macrolides cover atypicals. So this is often used for respiratory infections, but may cause prolonged QT syndrome. Fluoroquinolones, like ciprofloxacin and levofloxacin. So memory trick, flox can fix tough infections. So ciprofloxacin and levofloxacin, these are very potent antibiotics. They can cause tendon injury risk, so you want to avoid taking with some antacids, but that is a big issue with these kinds of medications. If you know someone is taking Cipro, we recommend that they don't run any marathons or do any heavy lifting and exert themselves for risk of tendon injuries. Endocrine and diabetes medication. So insulin, there's rapid acting and long acting insulin. Memory trick, insulin moves sugar in. Key points, it lowers glucose. We want to watch for hypoglycemia. There's metformin. A memory trick for this is metformin helps metabolism. So this decreases liver glucose output. It causes some GI upsets. And we want to hold this if a person is going to have contrast with a CT. They need to hold their metformin first. Thyroid hormones, like levothyroxine. Memory trick, levo lifts a low thyroid. So levo lifts a low thyroid. We want to take this on an empty stomach and monitor the thyroid stimulating hormone levels, or TSH. Corticosteroids. An example might be prednisone. Steroids reduce swelling. Okay, they're anti-inflammatory, monitor glucose, taper if prescribed long-term. What I would like you guys to do is come up with your own memory tricks for each of these categories. There is an activity at the end of this week where you will make 5 memory tricks that you've created. You'll post 5 memory tricks that you've created, so that there'll be helpful ways for you to remember something, and maybe you have a great way for someone else to remember something. And so you guys will be able to read each other's memory tricks. Psych and nervous system medications. So we have SSRIs. Typically they end in teen. There's also sertraline. but fluoxetine is probably one of the most popular. SSRIs raise serotonin levels in the synaptic space. Key points, this is used for depression or anxiety, but can often take weeks to have full effect. Okay? Then we have benzodiazepines. Now these end in LAM and PAM. So we have lorazepam, diazepam. So benzos bring brief calm. So they work quickly. They don't last very long. They're for short-term relief only. The biggest key points here: sedation, fall risk, potential for dependence. Antipsychotics. So we have a couple different antipsychotics, but some of the most popular you might see are haloperidol or Haldol and quetiapine. Antipsychotics organize thoughts. Okay, so it kind of takes people who have disorganized thoughts, disorganized thinking and behavior patterns and kind of organizes them back into baseline. Key points, we want to monitor for EPS, which is extrapyramidal symptoms, and sedation. Mood stabilizers, like lithium. Lithium is one of the most popular mood stabilizers. Lithium levels matter. So knowing therapeutic lithium levels, patients need to have their levels checked every few months. And this is a medication that's given frequently for bipolar. Lithium is a salt. It is a natural occurring element. And so we need to make sure we monitor our patients' sodium levels as well. Earlier, I mentioned building a memory palace to try and help with memory retention for different medications. So the next few slides, we're going to kind of talk about how to do a memory palace if that's something you choose to do. So first, you choose a familiar place, like your house, a dorm, a driving route, a classroom. Use a place that you can picture easily, that you know like all the details of, and keep your path consistent. So the idea is that you're going to walk through this house or drive down that road, or you know, visualize the classroom, and then you'll start in one place, and as you go through, each room or each destination, each location becomes significant as far as where you're going to kind of like categorize all these medications. So once you've picked your specific location, break the place into clear stops. For example, front door, couch, sink, bed. Use the same order every time. So if you're going to use your memory palace as your house, maybe you walk in the door, you walk into the kitchen, the next room is the dining room, the next room is the living room. And then think about where all the things are in each of those rooms. And you're going to stop, at different locations in each room. Then you're going to assign a drug category. So place one drug class in each spot. Keep familiar medications together, similar medications together. Example, in the kitchen, maybe you'll put all your endocrine medications in the kitchen. And then as you go to the sink, think of the different categories of medications that are there, and then go to the counter and different medications that are there. The stove, different medications that are there. You want to create vivid associations. So make the image strange or exaggerated. Use things that'll help trigger your memory retention. Connect the class of drug to a visual cue. Add color, motion, even humor. Walk through it often. So mentally tour your palace daily. Recall the class before looking at your notes. And we're talking about the class of medications. Add details as you learn more. This, you will get the best results with vivid imagery, repetition, and active recall. So what to put in each memory palace stop? So first you need a drug class. You're going to name the category clearly. Example would be beta blockers. Keep one main class per location. Then add some examples, 1 to 3 common medications. So for an example, for our beta blocker would be metoprolol. Start with the most familiar drugs that you know. Include common suffixes or endings like OLOL or PRL or sartan, okay? Use patterns to improve recognition. Create vivid visual story. So an example might be a slow turtle for beta blockers. Make the image memorable and specific. Key nursing points if you're in nursing. Add one major action to safety point. Example, slows heart rate or monitor for hypotension. So each stop should connect the class, examples, pattern, and a safety point. So how to review your memory palace. Okay, start at the same place every time, whether it's the front door or a starting place of your driving, um, road. Move around the room in order, or take the same path in order. Drive down the road the same, stop at each section each time. Picture each location clearly. Say the drug class out loud first. Then name some examples from memory, and then check your notes only after trying. This is going to help with retention and recall. Add one more detail. Include the action, the use, or a side effect. Build the location a little bit at a time. Don't overload it on day one, okay? So you're going to add to this and add to this. Like once you can clearly see all your beta blockers in the kitchen at the kitchen sink, then you can move to the pantry and add, some other kind of medication there. Practice in short sessions. So review for just 5 to 10 minutes at a time. Repeat this for over several days and use spaced repetition, okay? 5 to 10 minutes in small chunks will help you also with better memory retention. If you try to do this for 30 minutes at a time, by the time you're 25 minutes into it, you'll forget what was at the kitchen sink. Explain the room to a classmate. Draw the routine from memory. Teaching improves long-term retention. So one great thing you could do is take a blank piece of paper and draw your road or a blueprint of your house. And then just quickly jot down all the things that are in each room. You can use colored pencils, a pen with different colors, just to help get some better visualization in there. If you can mentally walk your palace, you can retrieve the information during testing. It's kind of like having a hidden cheat sheet in your head, but you have to be able to walk through it. I've included a basic blueprint of a house. You certainly can use something you're already familiar with, but this is just to show you an example. And then on the next slide here, this shows what each of those things could potentially have for categories or in each room, like the bedroom for psych and nervous system, the hall closet for respiratory drugs, the bathroom for renal and fluid balance medications, the living room for cardiovascular and blood pressure medications, the dining room for GI medications, the kitchen for endocrine and diabetes. The front entry or the foyer can be for anti-infectives like antibiotics. The garage or utility room could be for pain and inflammation. This is just an example. You can do any memory palace or mind map that you can create that'll help you with your memory retention. Okay, back to suffixes and prefixes. I don't expect you to memorize all of these. It would be beneficial if you make flashcards of these, though, to help with your own knowledge and for future courses that you're going to be taking. Each one of these has a drug class or group, and then a typical suffix or prefix that is associated with that class. So broad spectrum antibiotics often end in oxycin. Tetracyclines cycline, sulfonamides, sulf as a prefix, cephalosporin, ceph or enzyme ceph, penicillins and incillin, aminoglycosides or macrolides and in mycin, fluoroquinolones and in floxacin. Antifungals tend to end in azole or azole. Oral hypoglycemics end in ide, tide, or linide. ACE inhibitors end in pril. Remember my little memory jog there is seeing the ACE card with the pearl necklace on, and so I just remember of the ACE inhibitors end in pril. Beta blockers are probably the most common that people remember that end in LOL. Angiotensin II receptors end in sartan. Calcium channel blockers, pene and amyl. Vasopressin receptors, vaptin. Alpha-1 blockers, osin. Loop diuretics, ide and semide. Thiazide diuretics end in thiazide. Potassium sparing diuretics, actone, spiraldectone. HMG CoA reductase inhibitors end in statin. It's a hyperlipidemic. There's some anticoagulants on this slide. Factor X ends in XABAN. AROL, IRUDIN. Low molecular weight heparin ends in PARIN. Thrombolytics like clotbuster end in ACE or teplase. Antiarrhythmics end in APRONE, aprone. Opiates tend to end in DONE or ON. NSAIDs in OLAC or Proferin. Silicates like aspirin or ASA. And then non-silicate analgesics like acetaminophen. Gastrointestinal, so histamine, H2 agonists or H2 blockers end in tidine or dine, like famotidine. Proton pump inhibitors, or PPIs, end in prozol, like omeprazole. Laxatives end in lax, like Miralax. SSRIs typically end in teen and done. SNRIs, Faxin and Done. So the Done can be a little bit of either, but tricyclic antidepressants end in triptyline or pramine. Antihistamines. So this is respiratory, upper respiratory, okay? So second generation antihistamines, like ADINE. Second generation, end in ZINE or tyrosine. Second generation antihistamines again also can end in sine. So sine and zine for those second generation H1 agonists. Dean, zine, and sine. Nasal decongestants, Afrin and Zoline. Lower respiratory, so our beta-2 agonist like a bronchodilator ends in terol, like albuterol. Xanthine derivatives end in phylline. Cholinergic blockers like tropium or clenidine. immunomodulators and leukotriene modifiers end in Zumab or Lucast. While not needing to memorize all the prefixes and suffixes for this class specifically because you are able to test and have your learning materials with you, I think it's just an important way to help with memorization tricks and learning for future classes and career choices. Some common antidotes here. This is really important, making sure that we can give something to counteract the effects of a medication. So opiates or narcotics, we're going to give naloxone, which is Narcan. Warfarin or Coumadin, the antidote for this is vitamin K. Heparin, the antidote. Protamine sulfate, okay. Digoxin, the antidote for this is Digibind or Digifab. Benzodiazepines, okay, so flumazenol, cholinergic toxicity, atropine. Atropine is really good for getting rid of some of those cholinergic side effects. Acetaminophen or Tylenol, we want to give Mucomyst or acetylcysteine, sorry, is Mucomyst. Magnesium sulfate. So the antidote for this is calcium gluconate. Magnesium sulfate is a medication, let's say given during preeclampsia, during the labor process. And if given in too high of doses, we're going to want to have calcium gluconate on hand. Iron toxicity, deferoxamine. Lead toxicity, we want to give calcium disodium. Alcohol withdrawal, Librium. Beta blockers, glucagon. Calcium channel blockers, glucagon, insulin, or calcium. Aspirin toxicity, we're going to give sodium bicarb. Insulin reaction, glucagon. Tricyclic antidepressants, sodium bicarb. And let's say for cyanide poisoning, hydroxybalamine. So those are some of our common medications and antidotes. Common therapeutic levels. So digoxin, this is our cardiac medication. Therapeutic level, it's important to know because these are also medications that are routinely tested for patients. So digoxin, 0.5 to 2.0. Lithium, 0.6 to 1.2. Theophylline, 10 to 20. Phenytonin, 10 to 20. Magnesium sulfate, 4 to 7. Tylenol, 10 to 20. Gentamicin, 5 to 10. Salicylate or aspirin, 100 to 300. Vancomycin, the peak should be 20 to 40, and a trough should be 5 to 15. Valproic acid, 50 to 100. And that is the end of this lecture. It covers most of the material in part 2 of your book, which covers several chapters. This is the information that I want you to have a better understanding of for this class. It is not necessary to read all of the chapters in part 2 of your book. This PowerPoint is sufficient for what I am testing on and what I'm looking for. Thank you so much for listening.